everyone, I'm Dr. Z. I'm clinical psychologist specializing in adult transgender care. Welcome to my channel. If you've not had yet a chance to subscribe, I would very much appreciate if you do. This way you will help support my content and you also help a lot of other people find this content. For today's video, I will be sharing with you what is the most important thing, in my professional opinion, to consider prior to getting vaginoplasty. This is a great video for all of you who are thinking about getting vaginoplasty or are planning on getting vaginoplasty. Now, vaginoplasty in of itself, as we all know, is a big surgery. It's a surgery where a lot of people very much want not only aesthetically pleasing results, understandably so, but most importantly, want to have functional results, meaning you want to have that functionality intact. You want to be able to be in a position where not only are you not having any complications, but you want to be in a position where you remove any potential variables that can lead for any potential complications. And this number one thing that I'm going to be talking to you about that I think is super important to consider prior to getting vaginoplasty is absolutely going to help you eliminate, if not reduce, this complication associated with this, which is one of the biggest complications that I see trans women struggle with post-vaginoplasty. And I'm sure that whichever surgeon you're working with are going to be on the same page with me because I talk to a lot of surgeons and interview some even on this channel, and we all have consensus that this is really, really important to consider. So, without further ado, one of the things that tends to be really, not that it's not considered, it's that it is considered, but I think that a lot of people, in my experience, are assume that it's not going to be as challenging and time consuming as it actually ends up being. And that's, my dear friends, is making sure that you set up your life and set up your circumstances to allow you to dilate, yes, dilate, post-vaginoplasty as frequently as your doctor wants you to. Oftentimes, it is going to be 3 times a day, sometimes more, sometimes less, depending on the doctor and type of vaginoplasty you got, as frequently as you can to set up the life conducive for this. Why is this so, so important? It is very important because one of the biggest complications post-vaginoplasty is vaginal stenosis. Vaginal stenosis is when vaginal canal starts to close up and shrink. And one of the reasons the vaginal stenosis happens is when women post-vaginoplasty don't dilate as often, as frequently as they're being told to. That window after one gets vaginoplasty of depending again on vaginoplasty and your doctor, it could be a month, it could be 3 months, it could be 6 months, where you are required to dilate more frequently, more often than you otherwise would throughout your lifetime, is a very important window. And it's important because that's the time when your vaginal canal is fresh, new, sensitive, and that's why dilation is required. It is required not only to continue to stretch the skin of the canal, to continue to elongate the canal, but also to maintain the depth of the canal. And for those of you who are interested in penetrative intercourse of any kind, either through having vaginal penetrative intercourse with another person or using toys or hands, having a canal and a depth of canal becomes important. I know that a lot of you watching and a lot of you thinking, well, yeah, I do plan to dilate. Of course, I plan to dilate. It's important to me. And a lot of people I work with do have the same thought process in their mind. What a lot of people I find again and again that they don't realize is how long dilation takes and how you actually need to have some form of space for it. So let me try to explain. This happens all of the time, and this is one of the reasons why people just slack off, dilate less, or hope they can just catch up on a weekend, and it just messes up with the results. Oftentimes, when people think, oh, that's fine, my doctor said I should dilate, let's say 3 times a day after getting vaginoplasty for duration of 15 to 20 minutes each dilation, I can totally do it, not a big deal. What a lot of people don't realize is that it's not a matter of, oh, it's my time to dilate, so I'm going to go ahead, lie down, take the dilator, and start dilating. In the beginning, you're still going through the process of recovery, which means you might have discharge, you might have minor bleeding, which means things get messy. For a lot of my clients, what they need to do to set up dilation, especially in the first weeks post vaginoplasty, they oftentimes use pee pads so things don't get messy. Sometimes my clients will put dilators in a freezer so it's really cold because you're still swollen, and if you're swollen, it can be painful to dilate. So there's that to consider. Set up your lubricant, set up the environment to be able to have even space to do it. Those of you who work from home might find it a little bit easier. But what if you have to go back to work after vaginoplasty? What if you have to go back in the work environment? A lot of people don't realize how much and how long it might take them to set up. I had a client who it takes her just like 20 minutes to set up and 20 minutes to clean after dilating. That's already 40 minutes out of the whole dilating experience. On top of that, the scope of time it takes her to dilate. It can be anywhere from an hour to a little bit longer, maybe a little bit less. But this idea that you're going to be able to pop dilator in and dilate for 10, 15 minutes and move on in your day, I know it sounds very easy in our minds, but in reality, it's really not that easy. You really have to set up, you have to find a place to lie down. If you're working at, for example, in a work environment while you're going through post-vaginoplasty recovery and you have to dilate, where are you gonna go? Is there a private bathroom, not a stall, is there a private bathroom completely just all to yourself that you can use? If you need to lie down, where can you lie down? All of these factors a lot of times get incredibly overlooked. If you're working in a customer service or food service industry where you are on your feet, how is that going to affect your dilation? What if you're not able to take medical leave to allow yourself time at home to take care of yourself during this very fragile and very sensitive period? What if you have to go? A lot of people I know do have to go back to work. They don't have the luxury of medical time leave. And as a result, they go back to work and they realize that, oh my God, I thought it would be so easy. I'll just go to the female bathroom for 20 minutes, dilate there. Then they realize it doesn't work like that. There's lots of things to consider. Hygiene factors, you don't want to get things infected. Like I said, might be discharge or minor bleeding. Other things might get in the way. And this is number one thing that people do not consider. Not that you will have to dilate, but how exactly are you going to set it up? Whether your environment, whether your life enables you to do it as often as the doctor requires, plus to have a scope of a window open if you need to set up prior and then clean up after you finish dilating. All of these factors become really, really important. I cannot stress this enough. I have had clients who had no choice but not dilate because they couldn't. Their environment did not allow them to do it. And as a result, they told themselves, I'm just going to catch up when I come home in the evening. Well, when you come home in the evening, you just miss most of your day. You didn't dilate. It still can have consequences. Or some people tell themselves, you know what? I didn't get dilate throughout the day. I'm just going to do extra dilation when I come home, or I'm just going to dilate extra on a weekend. Recovery seldom works like that. Okay, so there's reason why doctors tells you to do it 3 times, 3 or more times a day, versus you can just do it once a day for a longer period of time. All of these factors are really, really important. They become even more crucial depending on the type of vaginoplasty you get. Did you get penile inversion, non-penile inversion, peritoneal pull-through, or maybe you got sigmoid colon vaginoplasty? All of those factors are going to play significant role in considering how you're going to set it up and what your setup is going to look for you. Again, this is very, very important because vaginal stenosis is a real thing. You do not want to have your canal shrink or start closing up. You do not want to lose steps. A lot of times people just think, if I lose steps, I can stretch it out down the road. Do not allow yourself that type of thinking because you have waited for the surgery for a long time. I know you have. And I know that this is a big surgery. And therefore, it's really important to do everything in your power you can to make sure that you recover as best as you can, because recovery is really going to set up the foundation for the functionality and the depths of your canal moving forward. It's the most crucial window of opportunity. And you want to, I always make analogies that your vagina is like a baby. You got a baby. When you have a baby, it's a crucial beginning window, right? Where you gotta take of it, you gotta nurse it, you gotta just like this window that is so essential to the baby development. Same thing with vaginoplasty, with your vagina. There's this window that is very essential time of recovery. So, my friends, if you're thinking about vaginoplasty, start thinking about, okay, do I have environment for it? What would it look like? Can I actually allow myself this? If you are in a position where you cannot allow yourself a time period to be able to dilate 3 times a day like a doctor wants you to, please at least talk to your doctor and say, look, I don't think this is going to be what are my other options? What else I can do to preserve the depths of my canal? All of those conversations are going to be really, really important. But you do not want to neglect this and then just wing it and end up with vaginal stenosis after everything that you have been through. Just not worth it. Comment below if you had already had vaginoplasty. What was the dilation time for you like? Were you surprised how long it actually the whole thing took you, the whole setup and everything? Or, how did it just go for you in general? Comment below, let me know. And if you are planning on getting vaginoplasty, let me know if you do have environment that will enable you to fully recover during the window. Comment below. Love reading all of your comments, and I will see you all next time. Goodbye.